Hello, this is Finance, Risk, and Cost, Week 2, Discussion 1 for MHA618. My name is Lisa Vincent. Our hospital has a choice to make to invest in our future. We have 3 plans to choose from: integrating our electronic health records, renovating our current facility, or expanding our facility. All 3 of these would be good for our organization, but one choice can both decrease costs and improve reimbursement. Integrating our EHR system will decrease our costs and improve our quality of care while positioning us for value-based reimbursement. Clinically integrating our EHR means that all of our inpatient and outpatient facilities will use a common system where the patient's entire record is available in any of our settings. Choosing to integrate our EHR will strengthen our position for the future. Current and future public policy will drive the decision to clinically integrate our EHR systems. 1/3 of our patients are covered by Medicare, so their policies are of particular importance to our financial health. Medicare is rapidly moving towards a much more value-based and alternative methods of payment, and using an integrated EHR facilitates the cooperation needed between departments and organizations. An integrated EHR is required for our hospital's full participation in these payment models. Implementing an integrated EHR will also protect patient privacy more effectively, increasing our control over the safety of patient data and decreasing the risk of fines for breaches of HIPAA. Starting from our projection of an increase of 5 to 10% in patient volume next year, we are already on track for higher profits than last year. Implementing an integrated EHR will increase our efficiency and our potential for profit in many ways. First, we have many patient complaints about duplicated testing related to our fragmented medical records. If our providers had access to all test results, we could decrease our expenses on performing these unnecessary duplicate tests. If Medicare increases value-based payments, that will increase the value of our EHR integration. A decision tree links choices with outcomes. This decision tree shows the probable effects on profit of integrating the EHR and projected changes to Medicare reimbursement. If our EHR integration is unsuccessful, we will experience low profits, especially if Medicare does not increase value-based payments. However, the likelihood of Medicare increasing their use of value-based payments is high. In that case, our profits are reasonable even if this project fails. And if the project succeeds and Medicare increases their use of value-based payments, our potential for profit is high. The economic challenges of integrating an EHR system involve the costs of implementation and cultural change across the organization. These expenses are less fixed than that of a new building and will depend on leadership's expertise in driving the organization forward in this project. EHR implementation is costly and time-consuming. We may have added expenses in information technology staff and equipment. The cost in time and effort to change the culture of the organization can be extensive. There are also costs to maintaining the system. Regular updates are needed and additional training. However, the incentives are significant. Medicare offers direct incentives for EHR implementation, which will increase the value of this project. Increased efficiency throughout our organization should drive lower costs in all departments. As Medicare and other payers increase their use of value-based payments, we will be able to leverage our integrated EHR to increase our earnings. An analysis of the coming healthcare trends also supports the decision to integrate the EHR. Many of the expected changes to our industry will require an integrated EHR for participation. An integrated EHR will be more convenient for our customers and will eliminate many of their complaints about duplicate testing, transporting their own records, and not having test results easily available to them. As mobile devices are more widespread use for health monitoring, an integrated EHR will allow our organization to access and use this data in patient care.